Hi, my name is Christina McGee. I'm a pelvic floor physical therapist in Austin, Texas with BirthBabyBody. I'm also employed by Sullivan Physical Therapy here in Austin. And I wanted to share some things today that you can start working on, even if you're home in that postpartum period, to try to start recovering pelvic floor issues like urinary leakage, pain with intercourse, diastasis recti, some things you can put in place to start healing now, even if you are not able to see your physical therapist right away. So, Sophia and Catherine had sent me some questions about this time, and one of those was, is physical therapy open right now? Speaking for our clinic, yes. We are open and we're able to see patients in person if they feel comfortable coming to the clinic. We are abiding by all CDC and World Health Organization recommendations for healthcare providers, and we're able to see people in person, get them plans, get them programs that they can do at home in between their visits to get on the road to recovery. We are also able to see them via telemedicine if that feels like an option that works for them better, if they're stuck at home with all their kids, can't get away to an in-person appointment, or if they feel uncomfortable or they are inappropriate to come to an in-person visit. We can absolutely see them via telehealth. We've been having a lot of fun doing that. We can recommend things specific to their home setup, like if they have a work setup and they've been in pain when working from home, we can actually look at that setup, which has been a really nice benefit. We can also just give them recommendations on how to move, exercises that are the right fit for them, educational pieces that they can put into place right away and start getting better. Those telemedicine appointments are being covered by insurance at times. You have to check with your insurance plan specifically. If you go to www.sullivanphysicaltherapy.com and click on telemedicine, it's a blinking red light. Click on that and it will give you instructions for how to find out if your insurance company is covering telemedicine visits. There are also self-pay options for those telemedicine visits. Then I wanted to start going over some easy things you can put in place at home right now to start recovering. The first and most important of those is going to be posture. I know that sounds really basic and easy, but when we're in good posture, all of the right muscles start firing and you actually don't have to do a ton of exercises. We just need posture to be restored. Our organ systems also work a lot better when we're in good posture. So we're going to stand up tall. And imagine those strings coming out the top of our head, not our chest. We don't want to be forward, top of our head, and try to be really, really long. As you do that, you're going to go ahead and blow out your mouth lightly, like you're blowing a dandelion. And you might feel as you do that, that your belly just pulls in a little bit. You should feel like your belly button is just hugging back towards your spine. That is going to put in place some nice activation through your transverse abdominis and through some tiny muscles in your back. And you might even feel your glutes activating a little bit as you're in that good posture and turning on those stabilization muscles. That's the first thing. Next, we really want to work glutes. So when we're in that pregnancy posture, that leaning forward posture, our glutes or our butt muscles just turn off. So some of my favorite exercises to get back to are sit to stands, which sounds so boring and basic, but everyone has a chair. So you can go from sitting to standing, to sitting to standing, to sitting to standing. Your glutes are going to start feeling it pretty soon. Once they're used to kicking on, they're going to be better able to support you in posture and in function, which is going to protect your pelvis. It's going to protect your knees. It's going to help support you upright. So sit to stands or bridges where you're laying down and lifting your bottom off the floor. Those are my favorite exercises, and I will demonstrate that in just a second. I'm going to show you how to get yourself the diastasis recti. Diastasis recti is that separation that can happen in your abdominal muscles with pregnancy. It's very common, but you're going to want to check yourself. So take 2 fingers, place them at the top of your abdomen, and then lift your head up. And you're going to feel back and forth, squiggle back and forth all the way down your abdomen, and you're looking for a divot or a little cavern somewhere within that space. It'll be right at the midline of your abdominals. If you find one, we're particularly concerned if it's over 2 finger widths. It's over 2 finger widths, but we don't want any separation at all. If you find that separation, you don't want to be doing crunches, sit-ups, planks, big back bends, or big twists. So options for exercise are things like we talked about, standing up tall, pulling belly button in, bridges, where you're laying on your back, lifting up your bottom, or exercises where you're laying on your side, like lifting a leg, or exercises on hands and knees. Those are all things that you can start out with on your own. If you're having urinary leakage during coughing, sneezing, I know it's allergy season, lots of different types of sicknesses are going around right now. Coughing and sneezing, leakage is urinary incontinence. And can't necessarily make sure everyone's doing a perfect pelvic floor contraction at a distance, as I can't do an exam, but it should feel like you're holding back urine and holding back gas together. And you're going to want to do that right before you cough or sneeze. So it should feel like holding back urine, holding back gas, and pulling up and into your body, almost like you're lifting the perineum, or that section between the vaginal and anal openings, up off the chair without you actually moving. And then if you were to have to sneeze, you would do that contraction first, achoo, and that should hold back urine. If you're finding that you're trying that and it is not working, please seek out a physical therapist consultation. We can make sure that we teach you how to do that correctly, because many people, if just told or they just read how to do that contraction, about 30% of people are not going to be able to do it correctly. They just need a little extra cueing or in-person teaching on how to do that. One other thing you can do is look at what you're eating and drinking. Being at home, we are so far off our normal diets. I can speak for myself, and I've heard some other friends talking about it too. Start grabbing things we don't usually eat during our workday, or we're grabbing like kids' snacks all the time, or maybe things we don't usually drink during the day now are finding their way into our lives. So anything with caffeine, anything with bubbles, including bubbly water, really acidic foods, spicy foods, alcohol, and we already said carbonation, artificial sweeteners. So all of those are going to make it more likely we have bladder leakage. So if you're just grabbing more bubbly waters out of the fridge, you're having more glasses of wine than usual, more soda, whatever you're drinking, keep an eye on that. Your bladder handles water better than it handles anything else. So try to drink more water, less other stuff, and you're going to end up with less bladder leakage. I just recently did a postpartum recovery webinar for Sullivan Physical Therapy. You can access that on our website at www.sullivanphysicaltherapy.com. It'll cover the same things we did today, plus a little bit more. Or please get in touch with me at Christina, Christina, at sullivanphysicaltherapy.com. I would love to answer questions and help you get started on a plan that works best for your body. Have a great day, stay safe, wash your hands, enjoy being home as much as you can, and have a great rest of your day.